Well, hello there guys. I am back today to do a pregnancy update. So I turned 22 weeks yesterday. My new turnover day is on Tuesdays. So I'm currently 22 weeks. This is my 4th pregnancy, 3rd baby, God willing. And we are so excited. There's been a lot happening the last couple weeks. If you don't follow our vlog channel, then there's gonna be a lot of updates for you in this video. So let's just hop right into it. So being 22 weeks, baby is already the size of a coconut or a corn on the cob. I use 2 different apps. I get asked a lot which apps I'm using. I'm using Ovia Pregnancy and the Bump app. I just kind of go back and forth. Honestly, with this being my 3rd pregnancy to get this far, I don't really look at the apps that much. I'm not like crazy into like with the first where I'm like, what exactly is happening right now and everything, because I'm just happy baby's growing. I can feel her moving now. And I said her because if you don't follow our vlog channel, we now know we're having another girl. So we have 2 girls already, 3 and 2 years old, and we're about to have 3 girls, which is kind of crazy. We definitely are going to have our hands full, especially in the teenage years, but we're very excited. And so she's moving all the time now. I started feeling her move at 20 weeks, and then Ryan could feel her within like a couple days. She has very strong kicks, and the girls, Rev and Ari, were actually able to feel her move yesterday, which was, or 2 days ago, which was super cute and hilarious. My oldest was super excited, but my youngest, she wasn't thrilled about it. I'll link that vlog up above if you guys didn't get a chance to see it, but it's pretty hilarious. Yeah, this pregnancy has been rough. It's been a lot harder than with the girls, and mainly that's just due to my connective tissue disorder. You guys know if you've watched my channel for any length of time that I have Ehlers-Danlos syndrome, and starting about, I think, week 19, week 20, I started having just hip dislocations just from walking. So I already have hip dislocations obviously with EDS, but now I could just be walking around and my hips start popping out. So that's not fun. And it's a little scary, to be honest, knowing that I'm only 22 weeks right now and I'm already dislocating my hips just walking around. So I'm kind of scared to know, like, when baby is, you know, 8 pounds, which is likely because both of our girls were 8 pounds 11 ounces and 8 pounds 10 ounces. You know, what kind of effect is that going to have on me? I was induced with Revelin and I was induced sort of with Ari. So really I'm just hoping and praying that this baby will come when she's ready and will be healthy, but also so it's not so late that we have to induce just due to like the damage that it's doing to my body. So if you guys could pray for this baby to make a timely appearance, that would be great. But really, I just want her to be healthy. I don't want her to come early if it means she's gonna have to be in the NICU. Like, I don't want that. So like, really, I'm like, okay, you know, 38 week mark, let's go. Especially because Ari was 8 pounds 10 ounces at 39 weeks. Rev was 8 pounds 11 ounces at 41 weeks. So I feel like this baby, if they come later than 39 weeks, they're gonna be huge. And so I'm really not even worried, because I know how big my babies are, about this baby being healthy. Even if like she was born at 37 weeks, I think she'd probably be a healthy like 7 pounds and she'd be good. So I'm just hoping that, you know, I can make it till the end, not be induced. So this time around, I am not doing an epidural. I metabolized my epidural with Ari, also related to EDS, but with Ari I did, and it made me realize that I could do this naturally. If I could handle Pitocin-induced contractions without an epidural, I should be able to do it, no problem. And thankfully I have usually pretty fast labor and delivery. So fingers crossed again that I can make it through this time. If you guys have been here since I was pregnant with Rev, you know that originally I wanted to have a home birth, I wanted to have a water birth, I wanted to have no pain meds, but because of my anxiety and my PTSD, I was worried about that. Like, I didn't want to add on you know, the stress of the pain and having a birth at home and those kind of things when I was dealing with anxiety and PTSD. And now that I've had 2 kids already, I feel like I got this, I can do it. However, I did not know that I had EDS when I was pregnant with Revelin. I didn't get diagnosed until I was halfway through my pregnancy with Ari. And so there's a lot that I've learned about EDS complications, risk factors, things like that that come with having EDS when you deliver. So like one of the most common ones is early rupture of your membranes. So your water's breaking early. Thankfully, I did not have that issue with the girls. But then there's another one of hemorrhaging. We have a much higher chance of hemorrhaging after giving birth. And because of that, I'm not comfortable giving birth at home. Again, I have not had an issue with that with Rev and Ari, but it seems like for me especially, the more pregnancies I go through, the older I get, the worse my EDS gets. And so it's just not something I want to play with. And I really wanted to do a birth center birth, and they were literally right next door to the hospital, but they wouldn't even take me because of EDS. They were considering me high risk, and so they didn't even want to like take the chance. In the end, I am going to be delivering at a hospital that at least has laboring tubs, which I'm super excited about. You're not allowed or supposed to be allowed to deliver in them. Basically, if you get like super far, they can't move you. That's the only way you get a water birth, is if you like got really far and it was time to push and you were in the tub still, then they would go ahead and just do it there. But technically you're not like supposed to do a water birth. So I plan to labor in the tub as much as possible with this baby, with my hip dislocations. And also, I didn't even mention, I have degenerative disc disease in my lower discs. And this pregnancy, it's really taking a toll on me. It's making a lot of days very hard to walk, stand up straight. And so it's hard to find a laboring position and even a delivery position that is okay for my back, my hips, and my knees, because I also have patellofemoral syndrome in my knees. So there aren't many options for me that are a comfortable position for laboring and delivery. So I really think that the tub is going to be the best place for me for labor, because it's going to like take off some of that strain on my knees, my backs, and my back and my hips. So that's kind of like my plan. I'm more just talking about EDS in this update because that's really what has been the biggest effect on me. And now being in my second trimester, I don't have the nausea anymore. I'm getting my energy back. Some days I'm tired, and a lot of days I have to just lay down because of the body pain. But I feel like I have energy. I've been able to get up and clean and do things. And I've actually gotten a break from the back pain the last couple days, which has been nice. It's been a while since I woke up and had a few days in a row where I was like, ooh, I'm feeling pretty good comparatively. So that's kind of nice. I don't know if baby maybe shifted to a different position because, oh, I didn't even talk about that. We had our anatomy scan, obviously, which is how we know she's a girl. And she was face down. So she was laying like this, horizontal, but with her head down. So I actually have to go back for a repeat anatomy scan on Monday because they couldn't see all of the things in her abdomen and in her brain, I believe, because of the way she was positioned. And so I'm wondering if maybe she's moved now, and with that position she was doing, maybe that was putting a lot more pressure on my back somehow, and maybe she's finally moved out of that position, which is good because when I go back on Monday, I really don't want to have to do another one. And then on Tuesday, I do have to go to the specialist for the fetal echo, which I've done with Ari. They didn't have me do it with Rev, which is weird, but both my doctors, different doctors, really wanted that this time. Because I had a hole in my heart when I was younger. I forget what it's called, but basically a lot of kids are born with a little hole in their heart, kind of. It's very common. I don't think every baby is born with it, but a lot of kids are. But typically it closes before you're 1 year old. So it's not anything to be concerned about, nothing like that. However, mine did not close till I was 5, I believe. So it was a lot of ultrasounds and just watching it when I was a kid, and if it didn't close on its own, then I would have to have surgery. Thankfully, it did close on its own, but because of that, my doctors just want to know ahead of time if it is. And I don't know if it's maybe in any kind of correlation to EDS, but really, I'm just thankful. She's healthy. She's doing good. They didn't find anything wrong with the anatomy scan. They just want to make sure, double check everything, because they couldn't see it all. And then the fetal echo on Tuesday, and otherwise, besides EDS, I'm doing good. You know, it has been rough, and I'm not getting any sleep because I keep dislocating things in my sleep. I keep waking up to pee. It's all EDS related because you pee a lot when you're pregnant. That is not a secret. However, because of my, like, when you have EDS, it affects your ligaments, and basically it affects your bladder as well because of what, like, the tissue your bladder is made of. So my bladder is more stretchy than normal. So to begin with, even when not pregnant, I pee a lot. So now it's like literally some days I'm peeing every 30 minutes. sometimes even less. And then there's this whole other side too. I was researching, trying to figure out, because sometimes it's gonna be weird. I can't like finish peeing. Like it feels like I still need to pee, and I'll have to like go do something for like 3 minutes and then come back and then finish peeing. And so apparently, because of like my ligaments and stuff around my bladder area, they aren't the strongest. My muscles in that area are like overcompensating basically. So you know how they talk about doing Kegel exercises or whatever, especially during pregnancy, so you don't pee yourself. I think in all my pregnancies, I have only peed myself once. It was a very tiny amount, and that was when I was pregnant with Rev, I think. Otherwise, I have never peed myself, not while not pregnant. I do not have that issue, and it's because I have very like overly strong Kegel muscles, but that makes it sometimes hard to go pee, like because when I have like just a little bit of pee, it's like my body's holding in, it can't let it out. And so it just makes going to the bathroom a pain in the butt. And so when you add on being pregnant and the even more pressure from the baby on your bladder, it's terrible. Like literally I go to a store 10 minutes away, I have to pee before I go, before we shop, and then I'll usually have to pee like halfway between shopping, which could only be like 15 minutes, 20 minutes later, but because of the walking around and the more pressure from like my bladder just being stretchy and then the baby pushing on my bladder, it's constant, and I don't have a UTI, it's just all EDS. I almost forgot to do the bump shot. So this is my bump. I'm not wearing a fitted shirt, so it's kind of hard to see, but it is so close to being past my boobs. We're almost there. This is my 22-week shot that I took yesterday. I was wearing fitted shirt, so you can see there better. That was in the morning, so this is after lunch. So I'm excited to finally be looking pregnant, which is, you know, getting out of that awkward bloat stage is always a good thing. I hope that you guys enjoyed this little update. Mostly it was just EDS related, because like I said, that's really what's affecting me the most during this pregnancy. So I will actually be seeing you guys a lot the next couple weeks, because I have a bunch of different content planned for you. I have a fun sponsorship coming up. I have some homeschool videos coming up. I'm just excited. It's going to be a good couple months, especially with getting my energy back and being able to walk. I'm hoping that this kind of continues, that she stays where she is. I will see your wonderful faces next week. Bye.